Welcome to the Fit for Life Awards. We're very pleased that all of you can attend this evening, and thank you for coming. As most of you know, that our first awards presentation last year, because we're really still in the stage of startup of this foundation, we had three very outstanding laureates last year. Ciel Bleu, and we have the founder of Ciel Bleu, who is here tonight. Good Boost, and we have the founder of Good Boost, who is here tonight as well, who I haven't said hello to yet. I'm sorry, Ben. and Pulse Sync in Singapore. Those were the three laureates from last year. Each laureate, by the way, receives a grant over 3 years of funding from us. It's not intended for any special purpose, but in most cases, it's dedicated to these groups becoming bigger and better, using technology, moving geographically, and so on. This year, we received over 500 proposals for prizes. I know it sounds like an astounding number. But it's thanks to our operations and program manager, Sandor Naji, that he found platforms which would get to more people around the world, and we have decided to try to be as international as we can possibly be, which has always been a bit my orientation in my business affairs. And the quality of the organizations we got this year was just outstanding. And so when it's outstanding, you feel very good about it, but you have to do the triage and sort out, lots and lots of good proposals in order to get to the absolute jewels that you get to in the end of this sorting out process. This year we chose the best 4 out of this enormous number of 500, and you will meet them in person and in videos in just a few minutes. Now, Fit for Life is going into its 3rd year of existence, and we have a lot of plans for the future. And of course, this will include the continued search for these outstanding organizations world over. These are organizations that are working to improve the health of those people who wish to be in healthy territory and are able to take care of themselves through our programs and the programs of our laureates. But it will also include some new inclusions. There is a real wave of mental health problems going around the world today. We want to know more about that. Of course, the nutrition question is posed by the environmental changes that are going to take place, but also, let's find a way to put it simply so people can find their way through this jungle of recipes that we get on the net. And we're also very focused on the early diagnostics of non-communicable diseases. These are the ones that come from being sedentary, too much sugar, and so on. We all know what they are, but this is a real pandemic for older people. The majority of older people, and it goes up to even 80% in some places, are victims of non-communicable diseases rather than some disease they caught. We are very pleased that you're all here tonight, and we hope you will see that it is possible with incredibly good activities on the ground to get people to change their way of life. These institutions or organizations, or whatever you might want to call them, they're associations, sometimes they're not-for-profit companies, sometimes they're NGOs, sometimes are doing work that I tell you is really impressive and can be measured in terms of impact. We will continue to identify as many of these as we can around the world in the coming years. So with that, I want to thank you for your support. I want to thank you for your presence, and I want to thank you for giving us the pleasure of knowing that we can talk to people realistically about getting fit, and we can convince enough people through these connections we have on the ground to actually do it. Now it is my pleasure to introduce to you one of my favorite people in the philanthropic world, Nicola Crosta. Nicola has a long and impressive history of working in the philanthropic world, commencing with the United Nations, then as head of philanthropy in the section of the OECD, and as chief executive for many years of the EPIC Foundation in the US. Now, 4 years ago, he founded his own firm and has focused on social impact for many philanthropies around the world and the measurement of the impact of these philanthropic organizations as well as businesses. His firm is called Impact 46. He was the first person I met who knew anything about philanthropy and who was willing to help me start up Fit for Life. So, Nicola, the floor is yours.
Thanks a lot, Jack, especially for the publicity. The big logo is always welcome. So as Jack said, I've been lucky enough to meet him and the family and to be involved since day one in Fit for Life Foundation. And when he told me, and he and Sandor told me, you have 5 minutes to speak, I thought, okay, how do I summarize in 5 minutes this incredible journey so far? So I thought I would just use 3 slides to share 3 things that I learned during this time. The first thing has to do with the importance of the topic. When I started collaborating with Jack, prior to that, I was completely neglecting the importance of the topic, both from a personal and professional point of view. Personally, 3 years ago, I was in my late 40s, so it's the time of the life where in theory as a man you should start acting strategically about your health and healthy aging, and I didn't even want to think about it. Professionally, interestingly, I had this great opportunity a few years ago when I was head of policy at the United Nations in New York. I was part of the group that had to draft the so-called Sustainable Development Goals that maybe some of you know. That word, and these are supposed to be the most important priorities for humanity, for the planet. We were 2.5 years on it. The result were 17 goals, about 160 more specific thematic targets, and guess what? None of them was about healthy aging. So we completely neglected that. So obviously it was a mistake. So I learned that working closely with Fit for Life. The numbers are very clear. We cannot ignore them. By 2050, basically 1 person out of 5 on this planet will be over the age of 65. We are talking about 2 billion people over 65, and about 400 million people will be over 80. And when you think about demographic trends, 250 is not very far. What the numbers tell us as well is that a very large portion of these people will live longer but will not live well. Obviously the consequences, potential consequences, if there is no change in this scenario are disastrous for those people and of course for those families that will have pressure from those people, obviously, and of course for society. Because when you think about the burden that these people can represent for society, think of the cost of, in terms of public finance. So the challenge is big and the topic is incredibly important, and this is something I have learned during the last 2 years. Second point I learned is that a different future is possible. And with Fit for Life, we have, as Jack mentioned, we are lucky enough to see a lot of different futures possible, a lot of solutions. And when I think of a different future, a different trajectory, I think of one where basically these 3 things need to happen. So first, people will actually live longer and better. Second, I think this point is very important. Aging will no longer need to be seen as a problem. It's interesting because when you see the words that are usually connected with aging is problem, burden, cost, challenge, never positive words. So the idea of starting to look at aging as an opportunity, and I think, and again, I'm not inventing anything. There's so much research that shows that when people are in better shape, of course, they can much more actively and positively contribute to society in the last years of their lives, and also think of the silver economy. I mean, the enormous potential that there is also in terms of production of products and services for these people in the future. And the third thing, obviously, is that this is possible only if we will observe radically different behaviors. So individual levels, so people will need to take care of themselves in different ways. And this is part of what Fit for Life also advocates for. I think of corporates. So corporates that will need to start more seriously thinking about offering products and services that can help people actually live in a better shape and not in a worse shape. I think in particular some sectors, food sector, pharmaceutical, of course, and similar sectors, and then governments, of course. And here I don't want to open the Pandora box, but we all know that today a big major problem in public policy is this focus on treatment rather than prevention. So radical shift that needs to happen there. The last thing I learned is about NGOs and social enterprises and their incredible role that they have to play. And I have to say that for a long time, when I was working mostly with governments, big corporates, etc., I've always looked at NGOs as these little cute, insignificant things run by people with a good heart, but with marginal impact. And I was wrong again. And Fit for Life, I think, is demonstrating this. I mean, Jack mentioned the 3 incredible winners of the prize last year. Now, in a few minutes, you will meet 4 incredible organizations. And what these organizations have in common are these things, is that they bring about the new solutions. They bring about innovation, awareness on healthy aging. And what I find most striking, and you will hear some examples tonight, is that this is not the classic charity little thing that helps a little number of people, which of course is a good thing anyway. But we are talking about scalable solutions, so solutions that have a business model, that can even generate revenues, or that can be replicated by others, or that can inspire public policy. So these are solutions with a big, big impact. And last point perhaps here is that, and I think it's important to mention it in the context of Fit for Life Foundation, this is finally a foundation that has decided not to neglect this topic, but not only to put some money on it, but to put it in the right way. And I often insist, as some of you know, I work with a lot of philanthropists and philanthropic foundations. The how money is given is as important as the how much. And what Fit for Life chose to do is very professional global sourcing, the incredible work that Sandor has done this year, the capacity to source innovation around the world, to carry out professional due diligence, to give unrestricted grants, which is not a detail because that's the kind of capital that these entrepreneurs need to grow, and finally to monitor very seriously the impact of these organizations. So that's what Fit for Life is doing. So I will stop here, and I want to just say congratulations to Fit for Life and the team, and thank you for your attention.
What we would like to do now is show you the inside view of each of the laureates this year on video. And we will certainly get around to questions afterwards, but I'd like you to see the differences there are in approaches, the different things that people do, all of which are aimed at mobility, all of which are aimed at a life as an aged person, which is a better life than many of these people have today, and which is aimed at finding solutions that didn't exist before and were not developed by governments or by research agencies, but by people working on the ground. So let's go to the videos.
Oncologist Thierry Bouillet and former athlete Jean-Marc Descotes created Camille Sport et Cancer in 2000. with the insight that physical activity improves the well-being of cancer patients during treatment and contributes to better long-term outcomes. Camille has designed sport therapy programs for various types of cancer and stages of the disease, from treatment to remission to cure. Camille Sport Therapy aims to reduce the side effects of treatment by restoring balance to the musculoskeletal system, which helps reduce pain and fatigue. It also improves patients' chances of remission and reduces the risk of relapse. The programs are delivered by sport therapists who have completed the graduate diploma in sport and cancer therapy developed by Camille in partnership with the University of Paris. Camille has created a 3-stage model of care that can be adapted to each patient's needs, from the start of treatment through to post-cure maintenance. The care pathway includes inpatient programs for people undergoing treatment, outpatient programs for people at the end of treatment or in remission, maintenance programs for cancer survivors. The Camille method is based on the science of human movement. Its effectiveness is backed by several international studies which have confirmed that physical activity is linked to an average reduction of the risk of relapse of 49% for colon cancer, 43% for breast cancer, and 57% for prostate cancer. It also reduced the risk of death from all types of cancer by 39%.
En fait, je me sens plus fort que jamais. Et je n'ai pas peur.
En faisant une pratique sportive, quelle qu'elle soit, on va participer à sa guérison. On va optimiser l'action des traitements.
On n'a plus ces douleurs qui sont persistantes et au contraire, les muscles, on les sent travailler et au quotidien, du coup, c'est beaucoup plus facile.
Plus on se sent bien dans son corps, moins on se sent malade. Et moins on se sent malade, plus on va dans le bon chemin.
Camille currently treats 3,500 patients per week in 80 cities across France, thanks to the expertise of 30 sport therapists. Remembering an experience with his disabled father, Oli Cassot started the Cycling Without Age movement in 2012. His aim was to allow elders with limited mobility to get outside and enjoy the fresh air and community around them. His solution was to build a trishaw and begin offering free rides to residents of local nursing homes. Soon, a group of volunteers signed up to take elders for rides as often as they wanted.
Skønhed, altså, ligesom om, selvom vi er blevet gamle og ikke kan holde ud og gå, så er det givet mig så meget, at jeg tænker, vi er ikke helt glemt her på plejehjemmet. Det er lige sådan tilpas. Det er fantastisk, det de laver her.
Cycling Without Age grew by launching Thrival local chapters, first in Denmark and later in 50 countries around the world. Affiliates operate and fundraise independently and develop their own culture. Affiliates sign a non-exclusive agreement with Cycling Without Age and commit to following the organization's vision and guiding principles. Thanks to its decentralized structure, Cycling Without Age has raised more than 25 million euros in 9 years. Most of these funds have been raised and spent locally by affiliates. Today, Cycling Without Age is active in 50 countries through over 2,700 affiliates with a total of 3,700 trishaws. 35,000 trained riders ensure that older people get out of their homes safely for a pleasant ride. The Cycling Without Age movement has offered 2.5 million rides since 2012. Today, over half of Australians are obese or overweight. Live Life Get Active was founded in 2014 to address this challenge by offering free fitness and health programs to those most in need, regardless of age, financial resources, or cultural background. Live Life Get Active offers free outdoor fitness classes run by professional trainers. Activities range from yoga and Pilates to cross-training and boxing, as well as classes for parents and children. Each 45-minute session includes exercises for all ages, and all equipment is provided. Participants are required to register ahead of each class. The data collected is accessible to the trainers and used to adapt the activity to participants' needs and to create a sense of community.
I've just got so much more energy and I just feel alive again.
The benefits are obviously the health, but also the social aspects really good.
I can feel much better, more energy. I have 4 grandchildren, so I can run around with them.
We're all happy, we all smile.
Live Life Get Active also offers live online fitness sessions and workshops on topics such as nutrition and physical, social, and mental health. Each week, over 2,000 people from remote communities across Australia attend these online classes. Live Life Get Active has introduced a program for doctors and nurses to prescribe Live Life Get Active activities through an online referral system. The health professionals then receive regular reports on the progress made by their patients. The organization has adopted a partnership by location model. Companies contribute funding for classes in their community, and the local government provides outdoor space free of charge. Health networks partner with Live Life Get Active through a licensing model, which gives them access to data for research purposes. In 2021, 10,220 people participated in Live Life Get Active sessions. They lost 17,576 kilos collectively and reduced their risk of diabetes by 11%. Mission for Vision is a non-profit organization working to eradicate avoidable blindness in India by providing high-quality eye care for the most disadvantaged in society. Cataracts are the leading cause of blindness in people over 50 in India. Visual impairment leads to loss of mobility, employment, and independence, as well as poor mental health. Mission for Vision focuses on preventing vision loss by providing free cataract surgeries and primary eye care in deprived rural communities and urban slums. The cost of the surgery is cross-subsidized by partnerships with social enterprises in 39 leading eye hospitals across India, which meet World Health Organization standards for cataract care. Mission for Vision promotes better eye health through its network of 100 vision centers, where optometrists and vision technicians offer primary eye care, prescriptions, and glasses at affordable rates, as well as referrals for free or subsidized cataract surgery. A vision center costs about 30,000 euros to launch and becomes self-sufficient after 2 years of operation. To reach remote areas, the vision centers organize eye screening camps, which can treat as many as 100 patients. Mission for Vision offers eye health interventions for children, such as screening and treatment for pediatric eye cancer and retinopathy in premature babies, which can lead to blindness. They promote road and workplace safety by supporting better eye health for heavy vehicle drivers and skilled workers. Mission for Vision also engages in advocacy to influence health policies at the national and international level. Mission for Vision is active in 21 of India's 28 states. Since 2000, Mission for Vision has performed over 2.5 million cataract surgeries and improved the vision of more than 17 million patients.
Well, what do you think? Should we applaud again? Well, now, of course, after this presentation, clearly 4 groups are going to get prizes, and signified by these trophies, which we're going to give them, and some money as well in a couple of weeks' time. And I would just like to say that we are so happy to have these 4 groups as our laureates. We are so happy to have people to see what they're doing, because I think there's not a lot of indication in the press or in other forms that lets people know that these things are possible. And so you can make headway, you can move forward, and the only requirement is our own personal support and the support of people who want this willingness to go in and do work on the ground and make it happen. So thanks to the laureates who will receive their trophies in just a moment. And thanks to all of you who I hope you'll take this back and think about this, and also talk to people about what's being done in the rest of the world. So first of all, I would like to have Elizabeth Kurian come up and receive her award. Now I would like Amanda King to come up live and get active, all the way from Australia. And I would like to ask Oli Casal to come up and get this. And for Camille, Antoine Dartigue. Now you're going to have the chance to listen to the questions that we're going to ask everybody who represents the laureates. And in answering these questions, I think you'll get a feeling for what really goes on in the work that they do, and also a feeling about their own emotions about what they do. And so I will start with Antoine. Antoine represents CAMI. Antoine, we have just heard how CAMI's physical activity program can reduce the risk of death from all types of cancer by 39% and reduces the chance of relapse by up to 57%. I mean, these are really remarkable numbers. And what is the science behind this that makes this possible, since I don't think any of us have ever seen this before?
My English is very bad. I prefer to speak French, sorry. Merci Jack. L'activité physique, en plus d'être préventif et curatif, c'est un vrai médicament, vraiment, dans le cancer et dans d'autres maladies chroniques. On le voit tous les jours, on accompagne 3500 patients atteints de cancer. Les effets sont dingues, à la fois sur la santé du patient, aussi bien sur les effets indésirables des traitements. Dans ces effets-là, on va avoir une diminution, c'est prouvé scientifiquement, de 40% de fatigue chronique en moins, en plus d'augmentation des chances de rémission de 50%, comme l'a évoqué Jack. L'activité physique thérapeutique, c'est une évidence biologique, c'est une évidence. J'insiste vraiment sur le mot. Je vais résumer en 3 critères. C'est un anti-inflammatoire, parce que ça permet d'augmenter les cytokines. C'est aussi, ça permet d'augmenter, alors comment l'expliquer, sur le système immunitaire. Voilà, ça renforce le système immunitaire, ça permet je suis pas scientifique à la base, ça permet de renforcer le système immunitaire, de faire circuler les globules blancs et les anticorps et de permettre de diminuer la prolifération des cellules cancéreuses. Donc j'insiste vraiment, c'est un vrai médicament, on le voit tous les jours et au-delà de la prévention, c'est un véritable médicament. Voilà.
So in general, basically, I'll make a quick summary. This question of physical fitness for cancer patients has a real effect on the metabolistic system, it has a real effect on the muscular system, it has an effect on the whole system, and a big effect on your ability to have immunity. And why wasn't this discovered before? And nobody knows, but CAMI, I think, has shown that this really works. And this is one thing which I would really like to see spread around the world from CAMI's experience and from these 3,500 per day numbers, which already are very big. You know, if it could be 30,500, it would be even better. So, thank you. Okay, second question. What are some of the biggest hurdles that you have had to overcome over the years to expand CAMI and hospitals to almost every major city in France?
On retrouve, effectivement, on est répandu dans une trentaine d'hôpitaux en France, dans les plus grandes villes, Paris, Nice, Toulouse, Lyon, etc. On n'est que en France pour le moment. On a 2 principaux freins, 2 principales difficultés qu'on a pu rencontrer, mais qui tendent à s'améliorer. La première, c'est le financement. Sur 2 aspects. On est une association reconnue, nous, d'intérêt général, mais ce n'est pas toujours simple pour une association d'aller chercher des fonds. Mais la principale difficulté, c'est que nous intervenons dans des hôpitaux publics et le système aujourd'hui de santé français. Je ne sais pas si vous entendez un petit peu parler, il y a certainement des Français ici présents dans la salle, mais c'est très compliqué. Il va y avoir une vraie transformation du système de santé. On est en pleine réflexion en France sur cette transformation-là. On a un désertement aujourd'hui des professionnels de santé. Il y a un vrai manque de moyens financiers, matériels. Donc, étant donné que les hôpitaux cofinancent nos programmes en ville, on les aide. Mais ce n'est pas toujours simple pour des hôpitaux de trouver du financement pour de l'activité physique thérapeutique. Ça, c'est le premier point. Et le deuxième point, c'est le manque de reconnaissance aujourd'hui des institutions publiques et du gouvernement pour l'activité physique thérapeutique, pour la santé. On avance vraiment. Il y a eu un vrai changement de paradigme et une vraie accélération avec la loi Sport sur ordonnance en 2017 qui permet aux médecins de prescrire l'activité physique thérapeutique pour des patients en ALD, dont cancer. Et ça a été une vraie reconnaissance des acteurs comme nous, comme Ciel Bleu, qui est ici présent dans la salle. Maintenant, il y a encore un énorme travail à faire sur, le remboursement par l'État, par la sécurité sociale, donc on y travaille. Et deux, la prescription, aider les médecins à prescrire de manière régulière, pérenne, automatique l'activité physique thérapeutique.
Basically, Antoine is saying that the two main problems are money, of course, and that's always the same problem when you're doing philanthropic endeavors. But also the second problem has been that the government has moved less slowly than the world has moved, and it was only in 2017 that they passed a law which said that physical fitness could be used in therapeutic remission and therapeutic rehabilitations from cancer operations and cancer interventions. So these two things are slowly getting better, and they have confidence in the future. But on the other hand, they've really had to struggle in many years before 2017 to get the idea of physical fitness to be a rehabilitation system for cancer accepted and approved by law. Okay, how do cancer patients generally react to your physical activity program, and is there any skepticism on its effectiveness by these patients? And what about healthcare professionals' reactions, and what is the percentage of patients that accept the proposed program? Just to cut short the time, traitons la question du pourcentage des patients qui rejettent. Ça nous donnera une idée déjà.
Écoutez, honnêtement, de moins en moins déjà, et on est autour d'un pourcentage qui se situe autour de 70%. C'est-à-dire 70% des patients que l'on rencontre, qui rencontrent la CAMI, on va faire une consultation initiale pendant 1 heure pour lui expliquer le programme, les impacts, donc quoi, c'est sécurisé, c'est individualisé, et lui expliquer tous les bénéfices et les impacts sur la maladie. Honnêtement, on est sur un taux d'acceptation dans nos programmes autour de 70%. C'est vraiment bien reçu et bien perçu par les patients aujourd'hui. Ça l'était un peu moins par les professionnels de santé. Et grâce à la loi, les mentalités des médecins ont changé et perçoivent maintenant, il y a tellement de rapports, d'études scientifiques qui prouvent les impacts et maintenant ils en sont tous convaincus.
The percentage that accept is about 70%, which is higher than it used to be. It's grown over time. And the 70% number is not the same for professionals of the medical world, including doctors. I know there's some doctors in the house, so I know it's not an insult to doctors, but it's true that they have to be brought along with proof and with numbers, impact numbers. And finally, what is the impact of physical activity on the mental health of a cancer patient?
Ils sont très nombreux, bien évidemment. Comme j'expliquais tout à l'heure, il y a les impacts sur la santé du patient, lutter contre les effets indésirables des traitements, mais le côté bien-être social, psychologique, il est incontournable et complémentaire des impacts de santé. C'est un anti-stress, ça permet de baisser la prise de certains médicaments. C'est une bulle d'oxygène, ça leur permet de créer du lien social. De sortir de chez eux. Et avec le Covid en ce moment, ces dernières années, c'était pas simple. Donc il y a une vraie dynamique de groupe, il y a un retour à l'emploi aussi, au travail beaucoup plus rapide. Et ces éléments-là, ils sont incontournables pour pouvoir lutter contre la maladie.
Yeah, basically, physical fitness is something that makes people more positive than they might be if they had none. And the other reason for positivity is that the social contact which you have in the groups that do physical fitness together are very useful for people to know that they can form friendships, they can say what they want to say to somebody who is close to them, has been close to them in doing the physical fitness. Thank you,
Jacques.
Okay, Ole, it's up to you. If you could just answer this question, what is the feedback you receive from your passengers, and what impact does Cycling Without Age have on their life beyond the ride itself?
Before I answer that question, I'd just like to thank you very much, Jack, for this wonderful and very important initiative, and for you, Sandor, as well, for the whole program that you've run. It's been a wonderful journey, and we look forward to the future as well. I'd also like to thank my partner in crime, Pernille, who's right here, and Alexander, who helped procure a bike in Tournon-les-Bains, just across the lake. And then, last but not least, Carl, our very good friend, age 94, who came with us all the way to Geneva. And actually, to answer your question, I'd like to quote Carl from our ride today, if that's okay with you, Carl. And I just wrote it down to make sure I have it all right. So we asked Carl, what is the impact of such a ride? And Carl says, it has a liberating and invigorating effect. You really feel that you're part of life again, which you don't feel when you live in a nursing home. It's extremely valuable to get on these tours on a bicycle. It's a wonderful way to be together. And this is quote unquote Carl earlier on today after we rode.
Bravo.
And of course, maybe to quote another of our very early passengers who gave name to our motto, which is the right to wind in your hair. And it was a lady that we took out for a ride, and she was blind. And one of our volunteers said to her, so what is it you get out of these bike rides? And she said that she got to hear the birds singing and smell the flowers and feel the wind in my hair. And I think that is a really wonderful way of describing what you get out of these bike rides, that you get to use your senses and feel the wind in your hair, regardless of whether you are sighted or not.
Okay, thank you. Next question, which we all are wondering about. What are the emotions of the people who actually push the bicycles and probably talk with the people who are in the bike?
So we call the people who are volunteers, we call them pilots, which sometimes leads to some funny confusions. People thinking that we are recruiting airline pilots to ride these bikes, and we actually do recruit some airline pilots as well. But usually our pilots report back that it gives them a sense of purpose by being able to offer their time and to serve, because it is something that we all yearn for in our lives, is that that gives meaning to our lives, and certainly that is combined, that is associated with a very high quality of life. That also is the reason why we have volunteers from the age of, I think the youngest that we've had so far was 12, and the oldest was 90. And that pilot was actually older than most of the passengers that he was riding around. And because I think it is also associated with happiness and good quality of life, that you can continue to be of value to society even after retirement.
And how do you ensure that the community of the trishaw drivers, that you're building around the world? You're in 50 countries. So how do you keep them principled and maintaining the basic principles of what you do?
That is also a very good question, and one that I think it may work, because we are based on volunteering, and whenever people affiliate with us, and we're getting close to 3,000 volunteers around the world. We do ask people, first of all, to take what we call the generosity pledge. Mm-hmm. Which means that they have to accept the fact that they will help others on board. So that means that if you are an affiliate of Cycling Without Age, setting up a chapter with a bunch of volunteers, then you are pledging that you will help others. And at the same time, you also pledge that you will obey by the guiding principles. So we have 5 guiding principles. First one is generosity. That is the driver of a lot of the stuff that goes on in our organization. The second one is stories, or storytelling, because that is what happens on these bike rides. We're 3 people, and stories are being shared, and smiles are being procured. And that leads to relationships, which is our third guiding principle. And then what we found, and this is probably one of the most surprising guiding principles that we have, is slowness. Because in this fast-paced world of people being very, very busy and being in a hurry all the time to check their emails and social media, we need to slow down. And slowing down allows us to be more mindful, to listen to others, to be aware of all the serendipity that can happen all around us. And so that is a guiding principle, and that is what we do when we are on the bike rides. I think Pernille made the statement when you joined, one of the things she said was, we're not really going anywhere on these bike rides, so why hurry? And then the final one is without age. And that is really because old age is really one of the last frontiers of discrimination that we have yet to solve. There's too much of that going on in society today. And so I think attracting people who believe what we believe, who believe in our guiding principles, means that we don't really have to control people. But we have we have 35,000 volunteers around the world, and they organize and talk peer-to-peer. And there's an enormous amount of self-control in that community as well. So we don't really have that problem.
So since you're already in 50 countries, what is your vision of the long term? Because it sounds like you've done a lot of the long term already. What's the vision of the future for you?
So we know that we have an amazing amount of impact. We have yet to find all the little gold nuggets, and we had a conversation earlier on as well with representation from Geneva University. I'd love to continue that discussion. But, and so we need to understand even more about the impact. But what I would love as well is that, my vision is one bike in every senior home in the world. As simple as that.
Thank you, Oli. Yeah, thanks very much. Now, Amanda, I have some questions for you.
Okay, Jack. Far away.
Offering, and this was my question. We all submitted some questions, but this was mine. Offering free outdoor activities is really wonderful. Everyone dreams of it, okay? And what are the pros and cons you have observed of making the classes free, and who pays for it?
Okay, when something's free, usually there's a catch. You know, there's a saying, there's no such thing as a free ride. But we wanted to prove that to be completely false, and our free offering into a community was such that we wanted to ensure that those that could not possibly ever afford to go to a gym or join a sports club or have the tenacity to go out and potentially just meet someone else in a local community could do so. We wanted to show that friendship and social interaction is free. When you actually meet people and you have fun, there's no price to be put on that. So we created environments that were free of charge, that people could come along with absolutely no form of discrimination. But they are open to 18-year-olds, and I think our oldest is 104 up in Queensland. They live very long up there. And they all come and they work out together. It's a fun activity camp, but it's like a Trojan horse. In terms of how we fund these activity camps, which basically improve people's physical health, their social health, their mental health, and afterwards we work on their nutritional health, is that we actually provide data back. We have a formulation that can actually explain the cost-benefit analysis for a health organization to fund our activity. We go into a community and we're there for 200 days of the year. And during those 200 days of the year, we change people's attitudes, first of all, and that changes their behaviors, and that then changes their desire to actually make greater changes in their lives, like looking at their nutrition. So once you can prove you can do something, then you can go to the government and say, well, how about we stopped 10 people going to the doctors this month? How about we stopped 20 people from developing diabetes? How about we actually prevent? We're all about prevention. We work with people who have issues, but we're all about prevention.
Who are the people you're trying to reach, and where do you find them, and how do you keep them over the long haul?
Okay, well, I'd like to say it's hard to find the people that we work with, but unfortunately 60% of our population are obese, and we live in an obesogenic environment. Fast food is everywhere. We are a very massive country, so there is a lot of social isolation, so there's a lot of mental health issues. And we have a very large percentage of lower socio-demographic issues in our country. It's probably about 4% that are the tall, blonde, slinky, rich people running off to the beach and in their big houses. The rest of the people are just normal, everyday households that are working hard to get by. They're under a lot of economic pressure, and the first thing they push to the side is their health. So it's quite easy to find them, Jack. They're in just about every community that's out there. Sorry, what was the next part? Finding them and working with them, engaging them. Engaging them is easy because we offer them something that's real. We have, our trainers are real. Some of our trainers are in their 60s, others are just coming out of college, and we recruit them straight out of college. They have to be at the top of their level, so they have to be a Cert 4. They have to have an organization. They have to have an understanding of exercise physiology. But they come on board and they're from the community, and that's the most important thing, because then they can relate to the people who turn up in the community. They can gossip about the councillor. They can talk about the trash not being collected. They can talk about the fact that there's, not enough dogs in the park, or where are the swings. So they all start talking about what's going on in a community, and that's what connects them. So engaging them is very easy. Once they realize that we're not going to sell them anything, they absolutely adore us, and that's when they spread the word. So the early adopters then tell their friends, and then they tell their friends. So the interesting thing is that when people first join, the risk profile is about 56% at risk, and then after about 10 weeks, that profile jumps to about 70% at risk. Suddenly realize that it's okay to come. No one's going to take the mickey out of them, and there's no stigma. We're also very multicultural.
And we know that you collect a lot of data, and that you work this data to see what impact there is and so on. And can you just tell us what is the process for doing that, and where does the data go, and how do you use it?
To enjoy what we offer, you have to register. And you complete a registration form. Within that registration form is hard-coded formula to identify if you're pre-diabetic, if you have a tendency for obesity. There is a mental health score, I don't know whether this is familiar, called K10, which actually is a screening to say whether you're mild, moderate, or severe mental health. We also look at your nutrition, how frequently you eat vegetables. Alarmingly, not a lot of Australians have vegetables because it's very hard distribution to get right into the rural districts. So what are you eating? How do you feel? How do you feel about your life? And very importantly is, do you actually have a network of family or friends that you could reach out to if you needed to? 27% when it was really good times said no. During COVID, it was 45%. Had a massive impact on our country. So we collect all of this data. It's updated every 10 weeks. The data goes to the trainer. So if someone turns up in the park, I can look at Jean-Philippe, I think I spoke to earlier, and I can say, oh, Jean-Philippe, he's had a stent put into his heart. We've got to keep an eye on him. Or Mary's just got some lower back problems, so we need to watch out for her. Jack, he has depression. So we'll really keep an eye on him and make sure that he's teamed up with someone else. That's how we use it, but then we go to government and tell them what shift in risk we've actually afforded. How many people have actually gone away from being pre-diabetic? What level of obesity have we dropped? Where is the mental health score gone? So we give them a cost-benefit analysis, and hopefully they give us some money in return.
So,
Me?
one last question.
All right.
Personal question. What inspired you to start this organization?
I used to have a very big job traveling all over the world, and I came back on a plane and I read this paper by Deakin University, which is in Melbourne, in Australia. And it basically said that Australia was fast becoming the fattest per capita country in the world. But the alarming thing was that our children were, 30% of our children are obese. And that's because of poor diet, poor education in terms of living a healthier lifestyle, and the fact that they are so socially disconnected from reality in terms of how to live their lives. So we've got it at one end with older people who are very socially isolated, and then we've got this other bit at the other end where they are socially disconnected. So that was my inspiration to do something about it.
Thank you, Amanda. Elizabeth, a few questions for you. We're all curious to know how you got to have such a big organization, but we'll start with the easier questions first. What are the implications of a loss of vision for an older person and his or her family in the context of a disadvantaged community in India, which I think exists in different parts of India, but in rural places it's really strong?
Sure. Good evening, everybody. Thank you so much, Jack, Sandor, and Joanna. It's an honor to be here. So to answer your question, over 95% of the people we reach out to, visually impaired people, belong to the most impoverished communities of the country. They are challenged in more than one way. It's not just a visual impairment. And so when you look at a combination of visual impairment and poverty and compromised health, overall health, low immunity, the challenges are really, really, it's impossible to fathom. It's very impossible to fathom. So we have our own research team. We try to understand what difference we make to their lives. People feel very dependent on their society, especially the family. There's loss of confidence. And when you look at simple things like, taking care of yourself, waking up in the morning, going to the washroom, combing your hair, shaving, things are almost impossible for these communities. When you look at opportunities to learn a livelihood, again, it's very difficult to comprehend. They're not able to do it. Mobility, hugely compromised. We looked at the mental health of people with visual impairment. We looked at the difference that the cataract surgery made to their lives. We found that over 87% of people with cataract had depression. They experienced depression. And once you give them the surgery, you give them the solution, the life just changes. And I've met grandfathers in the Thar desert of Rajasthan. When I meet them, what difference the surgery or the intervention had made to their lives. They said, I can see my grandchild. For the first time I have seen my youngest grandchild. These are things that you just cannot imagine. And of course, we also hear humorous stories. I met a lady in a very tribal, remote part of Odisha in East India. And I asked her, how has her life changed? She says, I can cook my own meals. Otherwise, I have to depend on the food cooked by my daughter-in-law, and she doesn't know how to cook. So, I'm finally beginning to enjoy life after 5 years of visual impairment. So that's a huge challenge. And then when you look at the family, yes, it's difficult. When you look at impoverished backgrounds, every adult member of that family has to go out and contribute to an income that the household gets. Very often people live on less than $2 a day, below the poverty line. And sometimes children are forced to work. It's easy to criticize and say, children shouldn't work. But what would they do? It's survival. 3 meals a day is sometimes not a reality for many. Jobs, education, a huge challenge. So what happens is that, women are often forced to stay back at home and take care of visually impaired elders. People usually live in a joint family system in India, especially rural India. 70% of India lives in the villages. So women are often forced to stay back and take care of the elders. Girl children are often forced to drop out of school. So what happens, overall progress, when it comes to the choice that women have for their own economic and social progress, it's often compromised. And of course, the impact on the GDP, I need not mention, because India is a huge country.
Thank you. One of the questions really relates to the low cost of doing surgeries when you have such a massive scale. And do these surgeries compete with higher quality places that are private places doing surgeries? And if that's the case, and they're just as good, what's the secret?
Yeah, the secret, I think, is I can summarize it into 3 areas. One is commitment, the second is creativity, and the third is culture. Competence in terms of, a committed government policy and funding. Of course, the funding needs to be much more, but India is probably the first country globally to have national commitment for blindness prevention as early as 1976. So that's the first level of commitment. The commitment of the healthcare professionals, especially the doctors, the optometrists, and the paramedics, they're highly skilled and very committed, very good leadership. And the third is there's increasing private sector engagement, private sector philanthropy investing into eye health. We have large corporates, we have family foundations investing in eye health. So that's the first area. The second is in terms of culture. In India, there's a culture of service, spirituality, giving back to people, especially, we have a large middle income group. And of course, there's a lot of wealth. So giving back to society is important. And it's inherent in our DNA to take care of the elders in society. So that really triggers many of us to do, want to do more. And many of the doctors and the optometrists in the hospitals that we work with, they work 6 days a week, long hours. They do research, they do training, and very often we have to force them to stop doing more than 25 surgeries a day, because more than that, could compromise quality. And the third is, of course, creativity. As you mentioned, there are excellent models that we have learned from, 30 years ago. Model of something like social enterprise, cross-subsidization, where at least 50% of the people coming into the hospitals are given care at no cost. And where does the money come from? The money comes from those who are charged for care. So when you have a hospital that caters to all segments of society, our 39I partners, they're a wonderful organization. The President of India is being operated in one of them. We have top businessmen, politicians, media personnel being operated there. And you have the poorest person also being able to access care in the same environment. So you always have to be at the top of your game. You can't compromise. And from one hospital in Coimbatore in South India, that was around 30 years ago, we've scaled up to 39. And it's learning from this. And the basic eye care needs of cataract and refractive error are able, and we don't need donations after 5 years, because the income that comes from the paying clientele takes care of those who can't afford to pay. The other is the comprehensiveness of the care, hospital-based services as well as prevention. Prevention and outreach communities going to remote villages and tribal areas. We've set up clinics in very remote parts of the country. So it's an innovative approach of preventive activity at the outreach and care in the hospital. And of course, technology. Telemedicine is something that we've been harnessing more of, because that's what gives access to people in very remote places. Some of them live 3 to 4 hours away from the hospital. Access is a challenge because the roads are bad, transportation is not adequate. And of course, the cost. India, we manufacture a lot of the equipment. In fact, almost all the equipment is manufactured in the country. Intraocular lens is manufactured, the cost just comes down. So a hospital that does around 10,000 to 15,000 surgeries a day is able to provide cataract surgery. The cost of a surgery for the poorest person, of course, he doesn't pay, is around $50. That's it. And it's excellent. And our partners are featured among the top-ranking centers in the country. What that means for us is that the most challenged person can dream of accessing care in the best facility of the country.
Thank you. I think all of us were struck by the 2.5 million surgeries done on cataracts that you've done so far. How much further does one have to go to take care of all the other surgeries that will have to be done with the number of cataract operations that are required in the future? What is that number?
India, we have around 1.3 billion people, and a large number of them are challenged. We have around 56 million people who can't see well, they're visually challenged. That comes to around a fourth of the world's visually impaired population. And of course, with COVID, 2 years of lack of service, lack of access, the backlog of care, the backlog of people needing care has increased. But the good news is, around 30 years ago, the prevalence of blindness in the country was 1.8%. Today, it is 0.36%. We've come a long way. And our national goal is 0.25. So I'm sure that if all goes well, we don't have another calamity or a pandemic, by the end of this decade, we should have wiped the problem. Very confident of that.
Yeah. And finally, one more question, because that's kind of one of the principles of what we're trying to do is to have more mobility for older people. Would you say that mobility is the key thing that these people who have been blinded and who can see again, is that the main thing that will change their life and improve their life?
Absolutely, Jack. You know, our research says that of all the parameters that you study, all the important factors that are important for healthy aging, a confident aging, an aging that is inclusive and, you know, where people don't feel isolated and marginalized, mobility is key. And we found that those who've undergone the intervention, 76% of them say they have no problem with mobility after the surgery. Whereas before surgery, just 9% felt comfortable walking around. And that's one of the reasons our founder, Mr. Chandrai, he's actually the wind beneath our wings. He's our guiding force. And he started investing in eye healthcare around 35 years ago. Perhaps the first example of private investment in eye care. And he and his business friends joined in. And I think the impact that the intervention has on society is something that encourages everybody to support. And the problem is big, but the solution is very straightforward. It's very tangible and you can measure it. So yes, mobility is key. And there's a dramatic change in the person's ability to just move around, walk, stand on one foot, because standing on one foot is a test, you know, of how a person can progress in life. Huge differences. That's what our research say.
Thank you very much, Olivia.